Hi, my name's Yolanda, and I'm the nurse on the addiction medicine team.
Hi, I'm Jillian. I'm the pharmacist on the addiction medicine team.
And we want to congratulate you on taking this first step in making this positive change in your life. And we're here to support you in being as successful as possible in starting buprenorphine for opioid dependence. We recognize that this can be a very nerve-wracking process. Many people have been able to complete this process with very few withdrawal symptoms. In this video, we're going to review what a low-dose buprenorphine initiation is, the contents of the kit, how to take the medication, and resources for follow-up care and harm reduction. So, what is a low-dose buprenorphine initiation? Well, buprenorphine is the main ingredient in Suboxone, and a low-dose initiation is a process where we are slowly introducing buprenorphine into your system while slowly and gently moving fentanyl out of your system without causing severe withdrawal. This is necessary because of how long fentanyl will stay in your body after last use.
For traditional buprenorphine initiation, most patients would have to be off of opioids for 4 to 5 days, which is nearly impossible. This is because of the way fentanyl is stored in your body tissues. Even after you stop using fentanyl, it will stay in your system for up to a week.
If you were to take a larger dose of Suboxone with fentanyl in your system, this would cause a severe withdrawal called precipitated withdrawal, which can include vomiting, diarrhea, joint aches, muscle aches, severe sweating. This is what we're avoiding by doing this low-dose initiation.
The buprenorphine low-dose initiation kit works by slowly introducing your body to buprenorphine over a week's time while still using other opioids. The buprenorphine binds to opioid receptors in your body very gently, and then also is gently displacing the fentanyl and removing it from your body. By the end of the week, you have more buprenorphine bound to your opioid receptors than fentanyl. This method allows your opioid receptors to stay busy and prevents triggering severe withdrawal symptoms. First, we're going to go over the contents of your low-dose buprenorphine kit. The contents of the kit includes medications, patient education, and also harm reduction supplies. It is important to follow the patient instructions that you'll find in your kit. These instructions outline what your dose is going to be each day of the week. Your amount of buprenorphine that you take will increase from day 1 all the way through day 8, and by the end, you'll be at your goal dose of buprenorphine. Buprenorphine naloxone is a medication in this kit. Buprenorphine is the opioid, and naloxone is added to this medication to prevent misuse. When taken underneath the tongue, the naloxone component is not significantly absorbed and will not cause withdrawal. The specific medications in this kit are buprenorphine naloxone in 2 different strengths, 2 milligrams and 8 milligrams. This kit also includes loperamide for diarrhea if needed, and also ondansetron for nausea if needed. It is always important to know what you are being exposed to so you can protect yourself. In your kit, you will find 2 different testing strips, one for xylazine and one for fentanyl. Xylazine has been found in our local drug supply and is also called tranq, which can complicate the withdrawal process. Non-prescribed substances such as pressed pills and stimulants such as cocaine contain fentanyl, which is why we are providing the testing strips in your kit. Directions on how to use the test strips can be found on the back of the packaging, including a QR code which links to a video demonstration.
So let's talk about how to take the medication. It's very important that you take the medication correctly because if it isn't properly absorbed underneath your tongue, it just doesn't work. So the first tip is to avoid all nicotine products 30 minutes before you do a dose of buprenorphine naloxone or Suboxone. The nicotine really can prevent the product from absorbing correctly. The second thing that you want to do is take a drink of water before you put the product underneath your tongue. This will help get your mouth ready to absorb the product. And our third tip is that on some of the days you will be cutting the films. You want to make sure that you have clean, dry hands when you're cutting the films, that you're using a nice pair of sharp scissors, and that you're handling the films by the edge. The next thing that you want to do is put the portion of the film underneath your tongue, either to the right or the left of the membrane that's in the middle of your tongue. While the film is under your tongue, it's really important that you don't eat or drink anything, and you should even try not to talk because you just want the film to sit there and dissolve completely. Good oral hygiene is very important while you're taking this product. So we recommend that after the film is completely dissolved, you rinse your mouth out with water and you wait 1 hour to brush your teeth. For the first few days of this process, you're going to be asked to cut films. Even if you received your first dose of buprenorphine naloxone in the emergency department, it's still okay to start with day 1 instructions once you get home. Now, in your patient education materials are very specific instructions about how to cut the films and how to dose for each day. To cut the films, you want to take the individual wrapper and use the scissors that are included in your kit and cut the top of the foil to remove the film. You want to try to handle the film by the edges, and you want to be as exact as you can be by cutting the film in half, and then you cut the half in half, and that will give you equal 1/4 pieces. And that is your dose for the first day, just a 1/4 piece. Then you want to take the remaining pieces that you have left over and put them back into the foil wrapper and fold the top of the foil wrapper over to try to keep the product as sealed as possible. If you have any unused medications at the end of this process, your patient education materials will tell you how to dispose of those medications safely. While Michigan Medicine doesn't have an outpatient clinic that can continue your buprenorphine naloxone prescription for the long term, we will set you up with one of our community partners. So it's really important that before you're discharged, you provide us with your contact information so that we can arrange your follow-up care. And you can provide that information on your patient agreement form.
The Addiction Consult team contact information will be in your patient education materials. Please reach out to us if you have any questions or concerns. We are here to support you and are committed to helping you achieve your recovery goals.